Hi everybody, welcome back. Today we're going to be doing a dissection of the sheep kidney. And if you look in your dissection kit, it should say sheep kidney on the little plastic part. And I cannot find my dissection kit, so I am using a cutting board and a kitchen knife, which is kind of gross, but that's what I have, so that's what we're doing. So first thing you want to do is you want to take the kidney out of the bag. And it actually might be a little bit easier to use a pair of scissors for this. Okay, once your kidney is out of the bag, you can kind of feel it. This one apparently got cut. Maybe I just did that, I'm not sure. But when you look at it, you should see that there's two structures kind of hanging off of it. The way the kidneys sit in the body is kind of like this. So they kind of curve inward, and the spine would be here, and then there'd be another one on the other side. And these two structures, one of them is going to be the blood supply. So that's going to be the renal artery and the renal vein coming in and out, bringing blood. And the other structure coming out here is the ureter. So this is the structure that brings urine from the kidney down to the urinary bladder. And you can see it's quite floppy and large. This normally has a little bit of smooth muscle tissue that surrounds the ureter. And so when the smooth muscle tissue contracts, it kind of squeezes the ureter. And that's how the urine gets down from the kidney down to the urinary bladder. It literally gets squeezed down all the way down, just like the intestine would squeeze food along it, or just like a tube of Go-Gurt if you were to squeeze it through like that. So what we're going to do is we're just going to cut this thing in half, and you're going to cut it on the coronal or frontal plane. So you're going to separate the front half from the back half, and you will use your scalpel and be very careful. I am going to use my kitchen knife. I'm just going to cut through, going kind of slowly, so I don't want to ruin any structures in there. So you can see here I've cut my kidney in half on a frontal plane or a coronal plane. And you can see there's sort of two areas that are very obvious. The outer portion of the kidney is called the renal cortex. It's kind of tan. And the inner portion is called the renal medulla. And you can still see that we have our blood supply attached and the ureter attached on this one. The nephrons are mostly here in the outer cortex, the renal cortex of the kidney. The blood supply comes in, brings blood in and out to the cortex, where it meets up with the nephron at the glomerulus. That's where filtration happens. The descending loop of the nephron dips down into the medulla before going back out of the medulla back to the cortex again, and then it'll meet up with a collecting duct. And obviously these nephrons, there's a million in here, and so they're microscopic. You can't see them by just a gross examination of the kidney, but the collecting ducts run back down through the medulla into this area right here that's kind of white. That's called the renal pelvis. The renal pelvis drains into the ureter, and the ureter brings the formed urine to the urinary bladder. That's it for today. See you in class.